I'm Dr. Lora Shahine. Welcome to my YouTube channel. Today, we're going to learn about what is egg freezing. I'm Dr. Lora Shahine. I'm a reproductive endocrinologist helping people build their family for over 15 years. And today I want to teach you all about egg freezing. This is an incredible opportunity that I have seen develop massively during my career. And I want you to learn if it's right for you. I really appreciate your being here, liking videos, commenting with questions that you have, subscribing to this channel really helps people find this information. There's so much medical misinformation out there, and I want people to learn all about their fertility so that they can advocate for their own care. So I'm going to do a few videos about egg freezing because it's such an important topic. This video is really focusing on the basics of egg freezing, what it is, a little bit of the history, and kind of where we are today. First of all, what is egg freezing? Egg freezing is an opportunity to preserve your fertility. So we are born with the same eggs we're going to have our whole life. As we age, our eggs age, and as eggs age, it's harder for them to go through all the genetic changes that they need to in order to fertilize with sperm and turn into a healthy baby. So when someone conceives easily and has a baby in their 20s, we're kind of like, yeah, sure, of course. When someone conceives easily and has a baby at 45, we're all like, wow, we know that that's pretty special and it's pretty unusual. So fertility changes with age. We've all heard this and we know this, but it all comes down to genetic function within the eggs. So with the ability to freeze your eggs at a younger age, if you want to try to conceive later in life, you can use these eggs that you have frozen and they're waiting for you. The process of egg freezing is basically like IVF with a pause in the middle. So with IVF, it's in vitro fertilization. It's a process of giving your body gonadotropins in the form of shots for about 2 weeks, and then doing an egg retrieval. So getting the eggs out of the ovaries. When we think about IVF, we think about it as a way to treat infertility and people using it as a way to get pregnant right away because they're trying. But egg freezing is like that first half of IVF. After the eggs are retrieved, they're frozen. So you're pausing. And then when you want to get pregnant later, you finish the IVF cycle. So you would thaw the eggs, fertilize with sperm, create embryos, maybe test embryos, and then transfer an embryo to the uterus to get pregnant. So egg freezing is a way of freezing your fertility preservation, kind of going through IVF with a pause in the middle so that you can freeze eggs so that in the future, if you need them when you're older and it's more difficult to have a baby naturally, you've got these eggs that are frozen for you. One way to think about egg freezing is thinking about it like you're donating eggs to your future self if you need them. So egg donation is a beautiful way of building families. I have helped many families this way. If someone has premature menopause, they have really poor egg quality, IVF can only do so much. IVF is only as good as the eggs and sperm that we have to work with. And if there's really poor eggs or very few eggs or no eggs, then someone can still be pregnant and carry and deliver a baby, but they could create the embryo using donor eggs. Now, donors are typically in their 20s because that's when the eggs are able to go through all of those genetic changes. And so the thought process of freezing eggs is freeze those eggs when you're younger, in case when you're ready to build your family later in life. If it's not easy, if it's not successful, then you have this option because of course you could do egg donation, but in a way, egg freezing is like donating to your future self. It may seem like everyone's freezing their eggs. You see celebrities reporting it, it might be in the media, but it's still a very relatively new technology compared to embryo freezing and IVF in general. It may be, the first pregnancy from a frozen egg happened in 1986, which seems like forever ago. But that was a really unique situation and it wasn't able to be replicated for many, many years. A new type of freezing called vitrification dramatically changed not only success rates with frozen embryo transfers, but also allowed for more learning and opportunities and understanding for egg freezing. The American Society of Reproductive Medicine, which is the Professional Medical Society for Reproductive Endocrinologists like me, they considered egg freezing experimental until 2013. That's when they finally lifted the label as an experimental procedure and sort of allowed it to be a little bit more widespread. And they're very cautious because they were nervous without having long-term data and kind of understanding. Now, as vitrification improved and as more experience came through in certain labs, in my career, I have seen egg freezing dramatically change, and it has been amazing. But I remember counseling patients even back at Stanford before 2013, just saying, this is really experimental. We are really only offering it back then, only really offering it to cancer patients who were going to lose their fertility, chemotherapy or some radiation, or even surgically lose their ovaries. And so we would talk about we can freeze eggs, but we just don't know long-term data. We don't know if they're going to survive the thaw. We have so much to learn. Now, fast forward 15 plus years, and I am really able to offer this to patients with much more confidence than before. But do remember, it is relatively new compared to a lot of the other fertility treatment options. As soon as ASRM lifted that experimental label, we started hearing a lot more about egg freezing. I remember in 2014, egg freezing cocktail parties. So egg freezing was all of a sudden this powerful option. It was considered sort of the new birth control, controlling your fertility. Like birth control helps you control not getting pregnant, but it doesn't sort of save your fertility for later. And we were realizing that, especially with just careers or not finding partners, or for whatever reason, people were having babies later in life and having more trouble. If you could freeze your eggs younger, it just frees up your career, it frees up your choices in life. And it all of a sudden, egg freezing was no longer this option only available to cancer patients, but it was really open to anyone that wanted to preserve their fertility and delay childbearing for any reason. I remember one of my dear friends, Dr. Amy Avazadeh, she goes by Dr. Amy. She was one of the first people that really embraced egg freezing, and she gave egg freezing cocktail parties in San Francisco, which is where she is, and went on Good Morning America talking about this great option. It was really, really exciting and wonderful. And a lot of people embraced it. It was sort of like egg freezing was the new birth control. It was a way to control your fertility even more than controlling when you didn't want to get pregnant. But okay, you could also freeze your eggs and have your family on your timeline. And that was really powerful. I remember a headline that was freeze your eggs, free up your career. And I remember that, but I also remember thinking, oh my gosh, I hope these people are getting really good counseling, because egg freezing is not an insurance policy. You don't get an automatic payout. You don't know if the eggs are going to work until you go to use them. And so society, pop culture really embraced egg freezing. And then I remember a few years later, in 2018, a couple of articles came out where people had gone back to use their eggs and it wasn't successful. And it was just this, collective gasp, wait, what do you mean that this isn't perfect? And logically you can sort of say, okay, yeah, I know not every egg is perfect, but you just kind of want it to be. I remember an article that came out in 2018 in the Washington Post. The title was "Egg Freezing Wasn't the Guarantee We Thought It Would Be." And it highlighted Bridget Adams, who was very open about her previous egg freezing, pausing her career. She was high in the tech world and just felt like this was an incredible option. But she shared that when she went back to use her eggs, that 11 eggs turned into one normal embryo. And when she transferred, it wasn't successful. And that was heartbreaking. It's heartbreaking for her, and it's heartbreaking for the other people that were really hoping that this would be a guarantee. So you can see this is a really important topic. It's not just black and white. Freeze your eggs, put them on a shelf, and everything's going to be okay. Freezing your eggs is amazing. It's wonderful. The technology is better today than it's ever been before. But before you do it, there's a lot to learn. And I have a lot of videos here about egg freezing. I want you to be prepared. I want you to know what questions to ask your doctor. I want you to know how to choose a clinic. I want you to think about how many times you should do an egg retrieval, number of eggs. I really want to help you through this process. I hope you enjoyed this introductory video to egg freezing. There's so much to learn, and I'm here to educate you. Like this video if it was helpful. Comment with questions that you may have, other topics that we should cover. Subscribe to this channel so you don't miss a video, and stick around for more learning.